everybody, and welcome to OpenAgenda.WTF, where the WTF stands for With the Facts. We're glad that you're with us today, and this session is going to be a continuation of what Lynn covered yesterday about the Affordable Care Act, only we're going to be focusing more on the state of Colorado and how the insurance system is working, and also how it is subsidizing healthcare for the undocumented workers here in Colorado. So with that, I'm Tracy. I forgot to say, hi, I'm Tracy. And you are?
Hello, I'm Lynn. Welcome, everyone. We appreciate you coming. We're digging into some big questions again today. What's really happening behind the scenes with the Affordable Care Act in Colorado? Just a quick recap from yesterday. The Affordable Care Act was passed in 2010, rolled out in 2014, designed for temporarily unemployed individuals, students, freelancers, people without employer insurance. Enrollment has surged in the Affordable Care Act from 11.4 million in 2020 to 24.3 million in 25, a 50% increase over the entire nation. In Colorado, we had a 69% increase from 2020 to 25. A big part of that is Colorado in 2022 rolled out a program called Omni Salud. It is a program that directly offers undocumented individuals and DACA recipients a safe way to buy private insurance through Colorado Connect, which is our Affordable Care Act entry system. The program costs about $90 million per year and is funded in various ways that we're going to explore today. And the fact that it's set up to offer insurance to undocumented individuals and DACA recipients are exactly the people that are excluded from the federal legislated Affordable Care Act. Low-cost Omni Salud is for folks whose income is below 150% of the federal poverty level. So the plans may be as low as $1 per month, and they do have reduced deductibles as well. There is also a regular cost Omni Salud for folks who have incomes above 150% of the federal poverty level, which you remember is $15,650. So that makes the federal poverty level at 150%, somewhere around $25,000 a year. In 2023, Colorado insured around 10,000 people. In 24, the cap was reached in 2 days and served 11,000 people. In 2025, 14,000 people. And for the coming year, 2026, we're instigating a lottery system since the funding has been reduced somewhat. So I believe all of the lottery applications for 2026 have already been filled out, and they'll be awarding those sometime after December 15th. The overview of the Omni Salud lottery system is that it's designed to allocate assistance for health insurance purchases to actually ineligible people in Colorado. To participate, the applicants must be currently enrolled in Omni Salud. They must live in Colorado. They must have that 150% or less federal poverty level income and not be eligible for other healthcare affordability programs. So by definition, These are for individuals who are undocumented, illegal residents of our state, and DACA recipients. It's a random selection, and about 6,700 individuals will receive the greatest savings on the program this year. Actually, eligibility requires undocumented status to enroll in the Omni Salud program. Did you have a video clip you were going to show us regarding how that works?
I do, and it's very interesting. This video is explaining the Omni Salud program that is part of Connect for Health Colorado, and it explains who it is for and why they are doing it. So let me share my screen here real quick, and we'll take a look at this video.
Having health insurance coverage is important for keeping you and your family healthy and getting you the care you need when you are sick. But insurance can be confusing. Omni Salud is here to help. If you are a person living in Colorado without legal status, Omni Salud is the key to unlocking the healthcare coverage you need. Omni Salud is a Colorado program that connects people who are without legal status to high-quality, affordable health insurance plans. When you sign up with Omni Salud, you get access to many of the same health insurance companies you've heard of by using the Colorado Connect portal. Once you select the health plan you want, you will have insurance to help you pay for important health visits, like when you need to see a doctor because you are sick or need a checkup. Omni Salud also offers financial assistance to help you pay for your health insurance if you qualify. To be eligible for financial help, you must live in Colorado, meet income limit requirements based on the number of people who live in your home, be someone without legal status. If you qualify for Medicaid, you are not eligible to get health insurance coverage through Omni Salud. Remember, Omni Salud is only for people who are without legal status. If you qualify for financial assistance with Omni Salud, you can get health insurance plans that offer no monthly fee, free doctor visits when you are sick, free preventive care to help you stay healthy, like regular checkups and vaccines, free mental health care, free pregnancy care, and low-cost visits for things like urgent care when you need to see a specialist or need help managing diabetes.
So I think we get the point. And I think another interesting thing, I'll let you continue about the lottery system and about the healthcare plans here in Colorado, but according to the federal government, they do not subsidize any funds for undocumented workers through at least the ACA, the Affordable Care Act, and Medicaid and so forth. However, the insurance companies, this is like a roundabout thing. We found that the insurance companies that offer insurance to the undocumented workers do get federal subsidized funds, although they do not track how much of that does go to these state programs. And also there's a federal program. Let me see if I can't do this all from memory, but there's a funding method that's called a federal state agreement, and it allows Colorado to use pass-through savings to improve coverage for undocumented workers. So it's a roundabout way that even though they say that these plans are sponsored by individual states, they do, in retrospect, get funding from the federal government in a roundabout way. Is that the way that you understood it as well, Lynn?
Yes. Federal pass-through funds. That's a tricky term that says we're just sliding this money through in the places where we want it to go, or whoever is making those decisions.
And it's very interesting, I think, that although we are not getting funds from the federal government, our state offers these plans to the undocumented workers. And in doing so, they're using our taxpayer dollars in order to fund these programs. And I'm wondering how ethical it is, and are they coming to the Colorado voters and saying, this is what your tax money is going for. Have you found anything about that, Lynn? Or
Well, the first thing I want to say is that it blows my mind that they literally have a website saying here is the place for undocumented people to get their taxpayer funded insurance. And that's my opinion. It pisses me off. Excuse my French.
But yeah, there's
Um,
so many people that are American citizens that don't have health insurance. Why don't they cater to those, the veterans, the young kids that are getting out of college that don't have a job? There's so many sectors in our society that these tax funds could benefit Americans.
Totally. And it sounds they did do an audit on our Colorado Medicaid system, including all of this recently, and were told they needed to pay the federal government back around $6 million. I believe that was the amount. And the Colorado legislators said, no, we don't want to pay it back because we don't like the way the audit was done. There was also an audit done in October of this year. The previous audit was done in June, and it found issues with sponsorship documentation, mission alignment, and executive credit card oversight, which means somebody's milking the system. Somebody's using executive credit cards for personal things.
And it's not just
So,
somebody, it's our government, our
yeah,
people in the legislature.
yeah,
Yes.
the people that are running the show. Yeah.
Yeah, come on.
The undocumented enrollment numbers. They say it covers all Coloradoans, or that's what the program is called. That's another piece of the pie, cover all Coloradoans. Omni Salud, as we can see, is really for non-eligible non-citizens and DACA recipients, and we've served over 33,000. This was up to 2023 since they launched it. So that was the first year or two. The growing enrollment, the rising costs, and the expiring subsidies, because Colorado and the United States is getting ready to make some changes. Things are going to change, and that's why the lottery system has been implicated. So there's definitely some big money. And remember, we talked about it's going directly to the insurance companies. The federal in 2023 was at $90 billion. That's about 6% of our federal healthcare budget went directly to insurance companies. And that's what our America First agenda is about. We want these monies to be used for our citizens. And that's the bottom line. What do you say, Tracy?
I'm reading here. It says the federal government subsidizes health insurance, these health insurance companies, for people who qualify based on citizenship or lawful immigration status. They say that it excludes undocumented immigrants, but as you can see through the video and the information that we have provided here today, it really does not. It's like a circle. Things are getting muddled up. I don't know how else to say it, but they're taking us for a ride, I believe. And I had no idea that any of this was going on. And it does infuriate me that we're not taking care of our American citizens first for undocumented citizens. I have nothing against undocumented citizens except they are here illegally. They need to go through a process. There are so many immigrants that are beautiful people that came to our country lawfully and they played by the system. I am aware of people that have been trying to come to America for 8 years. I know of one person. And it's like, I told them, why don't you just go get in one of those groups that are coming over the border? It's not funny, but it's true. And I do believe that we just want to get this information out to the Colorado voters or to anybody in the United States, I'm sure there are many states that have programs such as the Colorado Omni Salud program. Yeah, get this information out to the voters. I think the wool has been pulled over our eyes, that I feel that maybe today I can see a little bit more clearly. Thanks to Lynn and to the information that she has dug up. I had no idea. If you all are with me, you did not have an idea of any of these little shady programs going on back and forth between insurance companies, the federal government, the state, and everybody's pointing fingers at everybody else. It's their fault. Comment below. Let us know. Let's be vigilantes on this, and let's stick together as American citizens. Don't you think, Lynn?
Absolutely. We've got to stay informed. And it's all part of a bigger piece of the pie. When I started doing this research, I felt like the government loves to see us unhealthy. Maybe not the government. What do we think it is? Why is there such an influence to keep us unhealthy, to make our healthcare costs bigger? And the question I asked was, why would a government want to make its population dependent on the government? And the answer was, for the same reason Doritos wants its flavors to be addictive. You'll just keep coming back and let the government control you. So again, yes, let's stay informed, and let's not let somebody else write the rules.
Thanks, everybody. And we'll be back soon. And we look forward to reading your comments.